high-risk fall patients. The caregiver has a responsibility to listen for the alarm and to respond as soon as possible to see what has caused the alarm to sound. The Posey sitter uses a pressure sensor pad that is attached to an alarm box that will sound an alarm when the patient moves their weight off the pad. The Posey sitter can be adjusted to allow the patient to move about in bed and remove their weight from the pad for periods up to 10 seconds. Before installing the unit, test it by turning it on and setting the time delay to 0. The device should alarm immediately. Set the volume to the desired level and set time delay to the desired time. Turn off the unit and hang the control unit on the foot of the bed using the bracket. Connect the sensor extension cable to the pad. Place the sensor pad under the mattress at the level of the patient's buttocks. Connect the sensor cable into the 2-sensor jack on the control unit. Test the alarm again by turning the unit on before placing the patient in bed. Next, we will learn the application of Posey side rail wedges. Posey side rail wedges are an aid to preventing falls and injuries to patients. They can be used to help remind confused patients to not get out of bed without assistance, to close the gap between divided side rails to limit a patient's access to leaving their bed, or to protect patients who are restless or combative from injuring themselves. Posey side rail wedges can be placed on the bed in several configurations. One method is using one wedge to cover the middle gap between the side rails on both sides of the bed. Another method is placing one wedge at the bottom of the bed end side rail to limit access out of the end of the bed. The third configuration is to place 2 wedges on each side of the bed to completely enclose both sides. The fourth option is to place 2 wedges on each side of the bed and one at the head of the bed and foot of the bed for total coverage. Place the rectangular end of the wedge on the bed frame between the mattress and the side rail with the straps facing outward. The wedge is then secured to the side rail using the Velcro straps. Following is a demonstration of the Posey Freedom Splint. The Posey Freedom Splint is designed to be a multiple-use splint for arms, wrists, hands, and knees, and as an arm board. The splint can be used to limit movement and access to medical devices for confused or sedated patients by applying it over the appropriate joint. To apply the device, open the Velcro straps and wrap the device around the elbow, placing the open side on the posterior portion of the elbow. Secure the Velcro straps snugly. Check the patient's circulation frequently. Next, we will demonstrate the application of Posey skin sleeves. Posey skin sleeves are designed to protect IVs or wound sites and to protect fragile skin from tears and abrasions. The sleeve can be constrictive if the limb is large. The patient must be observed for circulatory compromise and skin irritation. Removal and skin inspection must be done frequently. To apply the sleeve, roll the upper arm opening down to the thumb hole. Slip the patient's thumb through the thumb hole and fingers through the finger hole. Roll the sleeve up the arm. The sleeve can be adjusted off the thumb or to a shorter length by doubling the material back on itself. Do not roll the material. It should be flat. Restraint warning. The remaining Posey devices are all considered restraints. The following is a list of warnings and safety considerations that should be reviewed before using any of these devices. Severe emotional, psychological, or physical problems may occur if the patient's movement is restricted. The patient may become restless or agitated if the restricted movement makes them uncomfortable. Consider other alternatives to using a restraint device. Do not attach the straps so that patients can use their teeth to remove or damage them. Devices that are applied too tightly may impair circulation or respiration. Tie straps securely enough so that the patient cannot get the strap over their head. A patient in a supine position who cannot sit up requires constant monitoring. Should the patient vomit, they could aspirate and suffocate. The next product demonstrated will be the Posey limb holder. Remember, the Posey limb holders are restraints. Posey limb holders are designed for those patients who attempt to remove medically necessary equipment or disrupt interventions, such as extubations of endotracheal tubes, nasogastric tubes, intravenous or central lines, and urinary catheters. They are also indicated when the patient presents a harm to themselves or others by their behaviors. Posey limb holders should not be used on dislocated or fractured extremities or when it will compromise an intravenous site. Before using with combative or suicidal patients, the nurse must assess the potential of that patient to break free of the device. They should not be used if the potential exists. To apply the Posey limb holder, open the holder cup by depressing the release buttons on the sides of the quick-release plastic buckle. Wrap the holder cup snugly around the wrist so that the connecting straps are on the anterior portion of the wrist. Close the quick-release buckle and pull on the adjustment strap to fit the wrist snugly. Tie the connecting straps to the bed frame. If you want the patient to have some range of motion, you can tie both straps together to a movable part of the bed. To limit the range of motion, tie the straps to separate areas of the bed to create a triangle. To use the Posey limb holders on the lower extremities, apply them to the ankle with the connecting straps on the lateral side of the leg. Always monitor the patient frequently and check for circulatory compromise of the extremity. Next, we will demonstrate the Posey finger control mitts. Remember, the Posey finger control mitts are restrained. Posey finger control mitts are designed for those patients who attempt to remove medically necessary equipment or disrupt interventions, such as extubation of endotracheal tubes, nasogastric tubes, intravenous or central lines, and urinary catheters. They are also indicated when the patient presents a harm to themselves or others by their behaviors. Posey finger control mitts should not be used on dislocated or fractured extremities or over IV sites. To apply the Posey finger control mitts, open the Velcro at the cuff end. Place the patient's hand in the mitt with their palm facing the padding. Close the Velcro snugly around the wrist. If range of motion needs to be controlled also, place a strap through the loops of the mitt at the wrist and tie to a movable part of the bed frame. Check for circulatory compromise and skin irritation frequently.